Yeah, so in this video, we will be talking about the differences between extradural hemorrhage and the subdural hemorrhage. First thing to understand about both is source of the bleed. In extradural hemorrhage, it has been found that the origin of bleed is the middle meningeal artery. So, if middle meningeal artery is getting damaged, for example, in case of a skull fracture, so the bone fragments, that is the fractured bone fragments, will damage the middle meningeal artery and leading to the extradural hematoma or extradural hemorrhage. While as if you see the subdural hemorrhage, it is mainly the origin of the bleed is the bridging cortical veins. So in case of subdural hemorrhage, we see bridging cortical veins hemorrhage. So what is the clinical difference? Mostly is that in extradural hemorrhage, the side or the site of the injury is usually unilateral, but the same is not true for subdural hemorrhage. Subdural hemorrhage can be unilateral or bilateral. So it can be unilateral or bilateral. Third difference which we can understand clinically from the symptoms of the patient is in extradural hemorrhage, when the patient gets the lucid interval, it will be followed by the unconsciousness. So lucid interval is followed by unconsciousness. So lucid interval is followed by unconsciousness in case of extradural hemorrhage, but in subdural hemorrhage there will be a progressive headache. There will be a gradually progressing headache, and the patient will show confusion, which will finally end in an altered sensorium. So patient will have altered sensorium. Fourth difference which we can understand is in case of extradural hemorrhage, you can very well appreciate that the hemorrhage or the hematoma, it will be limited by the cranial sutures. So cranial suture will limit the, since it is present in the extradural space, so the sutures can limit their spread. So cranial sutures limit them. But in case of subdural hemorrhage, they are not limited by the cranial sutures but by the dural folds or the venous sinuses also. So these are limited by dural folds or venous sinuses. Next difference which we can appreciate on the CT images of the two hemorrhages is the shape. Okay, the shape is very much important. The shape is a lens shape in case of extradural hemorrhage, or you call it a biconvex shape because it is a biconvex shape. Mostly we say lemon to remember it. So lemon shaped hemorrhage. But if you see the subdural hemorrhage here, you can appreciate very well a hyperdense crescent, shape. So we can say it is a banana shape also. So these are the differences which we can remember. So to conclude, let us revise them in a nutshell, that extradural hemorrhages happen due to the middle meningeal artery, subdural hemorrhages happen due to bridging cortical veins. Extradural hemorrhages are unilateral, but subdural hemorrhages can be unilateral or bilateral. Extradural hemorrhages, there is lucid interval which is followed by unconsciousness. In subdural hemorrhage, the patient will show altered sensorium. The shape of the hemorrhage in extradural hemorrhage is lentiform or lens shaped or biconvex or lemon shaped. In case of subdural hemorrhage, the shape is banana shape or a crescent shape. The cranial sutures will limit the extradural hemorrhage, but subdural hemorrhages will be limited by dural venous sinuses or dural folds. If you want more videos like this, you can subscribe to my channel Chambers and also list your topics in the comment section below. Thank you.